Hello, and thanks for being here. I'm really glad we have this time to talk. The whole idea here is to walk through your recent vitiligo diagnosis together, step by step. My goal is for you to leave this feeling like you have a clear picture of the condition and the path forward.
Okay, so you've been given this diagnosis. I know that hearing a new medical term like that can feel, well, overwhelming. It's completely normal to have a ton of questions buzzing around in your head. So let's just take a breath. We're going to tackle this together and make sense of it all.
All right, so here's our game plan for this discussion. First, we'll cover the basics. What is vitiligo? Then, the big question. Why is this happening? We'll go over how the diagnosis is confirmed, then dive into your treatment options. After that, we'll talk about day-to-day life with vitiligo, and finally, we'll look at the road ahead.
First things first, let's get a really clear, simple understanding of what this condition actually is, with no confusing medical jargon.
To put it as simply as possible, your skin has these special cells called melanocytes. Think of them like tiny factories that produce melanin, which is the pigment that gives your skin its unique color. In vitiligo, these little factories stop working in certain areas, and those areas lose their color, resulting in those characteristic milky white patches. It's really important to know this only changes the skin's color, not its texture or health.
Now, one of the first things people often feel is isolation, but I want you to know you are absolutely not alone in this. Vitiligo affects up to 2% of the entire world's population. That's millions of people across every race and every skin type. It's a common condition, and there's a huge community of people out there who get it. Okay, now let's tackle what is often the biggest question on someone's mind. Why me? Why is this happening? And the most important thing to understand right from the get-go is that this is not your fault. It's not something you did or didn't do.
So what's actually going on inside the body to make these pigment cells just disappear in some spots? Well, the answer actually has to do with our own immune system.
This really gets to the heart of it. Vitiligo is an autoimmune condition. Imagine your immune system is like your body's security force, always on the lookout for germs and invaders. Well, in this case, the security force gets some bad intel. It gets its signals crossed, mistakes your own healthy pigment cells, those melanocytes, for a threat, and it attacks them. So why does the immune system make this kind of mistake? A big part of it is genetics. There's a definite predisposition that can be passed down. In fact, for up to 20% of people with vitiligo, they have a close family member who has it too. A family history of other autoimmune issues can also be a factor. And we also know it tends to appear earlier in life, with most cases developing before the age of 30. Now, let's just quickly touch on how we actually land on a diagnosis. I want you to feel really confident in the process, which thankfully is usually very straightforward. The great news is that the diagnosis is almost always clinical, which is just a fancy way of saying we don't need invasive tests. We start by talking through your medical history and family history. Then we do a full skin exam to see the pattern of the patches. And finally, we use a special little device called a Woods lamp. It's basically a black light, and under it, the areas with vitiligo glow brightly, which confirms it. A skin biopsy is very, very rarely needed. Okay, this brings us to what might be the most important part of our chat, what we can do about it. And I really want you to see this as a partnership. We're going to explore all the options together and figure out a plan that works best for you. I think this quote from the medical guidelines really nails it. Treatment is not one size fits all. The goal is completely customized to your specific situation, the type of vitiligo, how widespread it is, and most importantly, what you want. Your personal goals are at the very center of this decision. So, broadly speaking, we can think about treatment in two main ways. If the vitiligo is what we call limited, meaning it's in smaller, more contained areas, we usually start with topical therapies, creams and ointments you put right on the skin. But if it's more widespread, covering larger parts of the body, our first-line treatment is often phototherapy, which is a kind of specialized light treatment.
Let's break that down just a bit more. You can see here, for limited vitiligo, we start with those topical creams. For widespread, phototherapy is our go-to. Now, if things are progressing really quickly, we might consider a systemic medication, a pill, to help stabilize everything. And further down the line, there are even other options like surgery for patches that have been stable for a long time, or in very extensive cases, something called depigmentation. We have a lot of tools in the toolkit, and we can discuss every single one. Medical treatment is one really important piece of the puzzle. But just as important is how you manage things day to day.
This is where we look at a more holistic approach that goes beyond just the treatments themselves. There are really 4 essential strategies here. Number 1, sun protection. This is non-negotiable. Skin without pigment has no natural protection from the sun, so you have to be incredibly careful. Number 2, avoiding skin trauma. Sometimes a cut or even constant friction can cause a new patch to appear. Number 3, cosmetic camouflage. Things like specialized makeup and self-tanners work really well for many people. And number 4, psychological support. We have to acknowledge the emotional side of things.
And that last point is so critical. A visible condition can really take a toll on your self-esteem and quality of life. That's a very real, well-understood part of this experience. So please know that seeking support, whether it's from a therapist or a patient support group, isn't just okay, it's actually a recommended and really vital part of your overall care.
All right, let's finish up by looking ahead. Understanding what to expect and what your next steps are is the key to feeling in control and moving forward with confidence.
I want to be straight with you. Vitiligo can be unpredictable, and it is often a progressive disease. But, and this is a really big but, our treatments are effective. For most patients, we can achieve significant repigmentation over time. A general rule of thumb with consistent therapy is you might see 25% improvement at 3 months, 50% at 6 months, and even up to 75% repigmentation after about 9 months. The key words there are patience and consistency.
So, after taking in all of this information, what's the single most important thing you should do right now?
It's this: working together. Your most powerful tool is creating a strong partnership with your healthcare team. Our next step is to take everything we've just discussed, the treatments, the strategies, and your personal goals, and craft a plan that is made just for you. You are at the center of this team, and we are here to support you every single step of the way.